Hello, everyone. It's Monday, May the 18th. There's no way around it. We've over the weekend we lost 5 more people. We lost a 76-year-old female from Wayne County, a 68-year-old male in Kanawha County, an 89-year-old male in Fayette County, a 69-year-old male in Fayette County, and an 85-year-old female in Fayette County. We all know of the issue and the problem that we had in Montgomery, and that is surely propelling our situation in Fayette County. We also all know, as I've said over and over and over, that this disease attacks our elderly, and it is really attacking our elderly, in our nursing home system or our system, and where our elderly people primarily are or can be. I would tell us all just this, that this disease and pandemic is with us, and it hadn't gone away. The sun and the summer should make things better. As we move forward, there's a lot of promise of a vaccine or a drug that will diminish this danger. But we're not there yet. Now, on the other hand, the balancing act is ever so clear. If we absolutely do nothing, we're going to get in even a worse situation. And that worse situation could lead to a situation to where we have an economic meltdown in this whole country. And if we have an economic meltdown, hundreds of thousands will die, and it will be catastrophic beyond all comprehension. It's a bad situation, and probably the toughest situation of my life. And I've been through a lot of tough stuff, and I'm able to handle this tough stuff because I've been conditioned and I've been weathered. And so with that, I ask everyone to not turn these deaths into statistics. Now we're at 67 people that we've lost in West Virginia, and we should all recognize in every way these are individuals with a name and a family and loved ones that I've said over and over. Please keep them in your hearts and your prayers. Now imagine just for a second. In this country, we have diminished to where now we're losing only, if you can imagine that, 1,400 people a day as an average. Now what if I were to say to you that we only had 5 major airline crashes yesterday, and we only had 5 the day before, and we're only going to have 5 today, in which we lose 1,400 people? We'd all be just on a heightened alert more than we probably are right now. We see us with the opportunity to open back up, and we have to. And our numbers are fantastic, and I'll get into those in just a second. But I tell you over and over, as we're opening back up and as we're monitoring these numbers and watching in every way we can watch, you see, if we didn't open anything back up and we still had people and staff going home at night and going to Walmart and whatever they may be doing and going back and forth into nursing homes and different nursing homes to treat people for certain things and everything, and sharing that help between other nursing homes and everything, in all honesty, we would probably be a lot the same as where we are right at this moment. We got to open back up. And our numbers are telling us absolutely to do it. I would end by just saying just this, is that you know if you're a high-risk category person, if you have chronic illnesses, if you are 65 and older, you know your health, and you know what you can do. And I ask you, please try to protect yourself and absolutely ask for help. You know, if someone is not willing to volunteer to go to the grocery store or whatever it may be, to be able to help you, ask for help. Call us and we'll try to get you the help. But we still got to be very, very cautious as we continue to do more and more and more. And we're going to continue to do more because we have to. We have got to open ourselves back up. And as we do that, we're going to watch. And our medical team and experts are watching in every single way. And absolutely, if the numbers start to trend in a direction, in a negative direction, then we pull back. And we either stop, or we go back, or we surely slow down. We're trying to thread the needle. We're trying to open with caution and tell you to be very, very cautious. Now, I'm going to read 2 or 3 things to you here. The reopening of week 4 in West Virginia Strong, the comeback, the reopening plan will begin on Thursday, May 21st. The Safer at Home order is also still in effect. Businesses allowed to reopen during week 4 should be on your screen. And guidance documents are posted on my website, which is also on the screen. Now, week 5. The reopening announcements today, I am announcing our reopenings for week 5, which will begin on Tuesday, May the 26th. Starting on Tuesday gives us a little more time to prepare and allows us to pause for Memorial Day in respect to those we have lost. I want to make sure we take care of our people first and foremost, and all of us are subject to, all of these things are subject to change, and we all should know that this is such a fluid situation that our medical experts are going to be constantly monitoring, and all these things are somewhat subject to change. Now, I would tell you this, that our hotspots, you know, as we transition to our new high alert status, our counties today that we are removing from the hotspots are Monongahela, Marion, Harrison, Jefferson, and Berkeley counties. And therefore, at this point in time, under the new system, we no longer have counties that are on the hotspot alert. And Secretary Crouch and Dr. Slimp and Dr. Marsh will be watching all of our 55 counties closely as we move forward with our new high alert status system, and they'll, I'm surely be there for your questions as we go forward on that. Okay. Let me just read this. On Friday, we sent out, we've been asked over and over and over, you know, about our cities and our counties. When I was giving you the briefing on Friday, we had not finished the applications for our counties and our cities. We were very, very close. And at 3 o'clock or 4 o'clock that day, our revenue people and everybody brought those applications. Ann Erling has done a magnificent job with that, and lots of contributions from our revenue department and those people that were really stand up and did a wonderful job in putting that together. And so later on Friday evening, we had consulted with the counties and the cities, some and everything, and then I think at 7:30 on Friday evening, we went out with that. And so now that application is out there, and I encourage all the cities and the counties to apply as we get applications, and we can work our way through them, and we'll work our way very quickly, and we can find things that they're absolutely qualified for. We'll get those monies on the way to them immediately. And the other thing I would tell you is just this. From the cities and the counties, we are still very, very hopeful, and the guidelines, the federal guidelines, are changing nonstop, and they're very, very fluid. Jim Justice believes, as he has believed from day one about all this, that the guidelines will become favorable for us before it's over. And even though we encourage you to apply now, we want to remind you just this, that you can continue to apply as we go forward. Apply now and absolutely get the dollars that are very restrictive dollars today. The state has exactly the same guidelines as you have. And so from the standpoint of the restrictiveness, it's severe right now. But as we go forward and those guidelines are relaxed, we'll be able to backfill, and absolutely you'll be able to retroactively go back, for all that I know, and pick up additional dollars, and the significant dollars. I am very, very hopeful that will be coming when the guidelines change, and I am confident that those guidelines are going to change, and they're going to change in our favor. So, but I urge you to go ahead and apply now, and then continue to apply as additional things come down the pike. Today, in working with all the different people, from the standpoint of our medical team and our medical experts and everything else, we now have guidelines on the indoor malls, from the standpoint of our specialty retail opening back up and our big box stores opening back up. Naturally, our malls ought to be open. And so from all that, we've asked for additional guidelines and everything. We've got them. We feel very comfortable with them now and everything. And so therefore, on Thursday, May the 21st, our indoor malls will be able to open with our specialty retail businesses. Week 5, which begins on Tuesday, May 26th, if Jordan, you're ahead of me and getting that up. Our state park cabins and lodges will be open to only in-state residents. Our indoor and outdoor bars will be open at 50% capacity. Our museums, visitor centers, zoos, spas, and massage businesses will go, I take it back. Our indoor and outdoor bars at 50% capacity on Tuesday the 26th. Our museums, visitor centers, and zoos, Tuesday, May the 26th. On Saturday, May the 30th, and I'm only doing this to give people heads up and give them a date to where they can start targeting and plan for and everything. Our spas and massage businesses will open on Saturday, May the 30th. Also, on Saturday, May the 30th, we'll be opening our limited video lottery retailers on Saturday, May the 30th. On the following Friday, on Friday, June the 5th, we will reopen our casinos on Friday, June the 5th. And our lottery director, John Myers, has worked closely with all the operations to develop guidance and with the medical experts to agree to be able to open and open safely. And those guidances will be up and they'll be up very soon. Now, I want everyone, again, to realize just one thing, and that is just this. As we continue to go forward and we get closer and closer and closer to dates, we're monitoring all the time. And we'll probably and very well could have to change. Hopefully we won't. And everything, the numbers right now are continuing to be just fantastic. And as we get closer and closer, if the numbers are this way, we just keep being able to open up more and more and more and continuing to just watch and stay on top of it. Now, if I could just tell you real quick, about our numbers and just think about this. Remember when I said if we went 3 days below 3%, we were rolling. And compared to other states, it is unbelievable to have 3 days under 3%. I mean, just think about it just for a second. Today, Virginia is at 16%. Pennsylvania is at 17%. Ohio is at 11%. And Maryland's at 20%. Now, just imagine. I just said if we could be under 3%. Today, West Virginia has broken under 2%. We're at 1.96% today. And yesterday, on our cumulative test and everything, on that graph that if we could get the graphs up, on that graph yesterday, on our West Virginia positive, our daily graph, on the positive growth graph, if you could go back to that. On that day yesterday, we dropped to 0.1%. Our cumulative number is 1.96%, and our active cases versus our recovered, and you can see it, we just continue to widen and we continue to trend the way we want to trend. All that's good. From the standpoint of our total testing, we're way, way, way out in front of anybody that's even anywhere close to us. We're at 4.2%, and everybody else is at 2.2 and 2.5 and 2.2, and nation's at 3.4. So we're testing more than anybody. Where our positives, percentage of positives are very, very, very low, and the cumulative average is great. The daily average is great. It tells us we can continue to open up. We're doing it as cautiously as we possibly can, and I absolutely commend you. I've gone over this till I'm blue-green. You West Virginians have knocked it out of the park. Please continue to do so. All you've got to do is just be safe, watch what you do, be smart, show the world just how great you really are, and just keep doing it. You can do it, and I know you can do it, and you've done it. And absolutely, as we continue to show the world just how safe we are and how smart we are and what an incredible place West Virginia would be to locate a business or for them to come to West Virginia to live, because we are the opportunity. We are the diamond in the rough. Now, we got to be really on our game, really, really careful. And our experts are going to lead the way with myself and all those that are working right hand in hand, and we're going to stay on top of it, and we're going to run to the fire if there's a problem. And trust me, West Virginia, there will be a problem. There's going to be problems. This disease is here. We have got to be careful. And if you will just please be super careful in what you do, we'll be fine. Last thing, I remind you again of the census. I know we're still way behind in being counted. We got to get counted, West Virginia. But that's all I've got.
All right, thank you, Governor. Now let's go to Dr. Clay Marsh, our coronavirus czar.
Thank you, and good afternoon. So I want to re-emphasize a couple things that the governor said. Certainly, we're all incredibly proud of the great work that every West Virginian is doing. But I want to reinforce the idea that as we come back together again, as we open our vital businesses and also open the businesses that give people a pleasurable life, then this is the time that we have the highest risk of starting a second wave of spread. And as we've talked about, probably more than anyone would want to hear, that following the appropriate safety precautions that we have really highlighted before, including physical distancing, which is really important because we know now that one of the major ways this virus spreads is by person to person and by creating droplets, which we can do by talking, singing, screaming, yelling, coughing, sneezing, is really important. The other thing that we really need to consider is to wear face coverings or face masks. And if we all wear the face masks and the face coverings, we protect each other. And if other people are wearing face masks, that protects us. So remember, the face mask or the face coverings are not just to block aerosols from coming to you, it's to inhibit the droplet formation that has virus in it from people who are asymptomatic or pre-symptomatic, who can spread the virus without even knowing that they have it. So that's really important as we come back out. And I really encourage people in West Virginia to take note of that, because the New York Times just had an article that's once again said that even though we've done well so far, we have the most vulnerable state health-wise, and certainly we could have many more problems and more deaths if we don't really pay attention to this next step. And given how well everyone in West Virginia did on the first step, we're confident on the next one. The only other thing I want to add is that following the R0 value, that the infectivity reproduction rate, how many people a single infected person can infect, in West Virginia, we've gone from 0.83 3 days ago to 0.89 to 0.87 to 0.88. So today we're 0.88, which means we're still reducing the growth of COVID virus in West Virginia. But as we come back out again, then that's something to pay attention to. Sweden, that's done a big study and trying not to have so many restrictions, now has a death rate on a per capita basis per million people that's higher than the US, that's done suppression. So importantly for all of us is pay attention, protect yourself, protect your neighbors, protect our state. And as the governor said, let's continue to be a role model and a beacon for the rest of the country. Thank you.
Thank you, Dr. Marsh. Next, let's go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Good afternoon, everyone. The governor mentioned testing and that we are over 4% in our testing efforts, and we're stepping that up. Let me give you a report on some of the testing that we're doing right now. We're doing high population density testing or community-based type testing in addition to or as a part of our African American and minorities task force efforts. We had 872 individuals tested in Berkeley County. This was last Friday and Saturday. We had 748 individuals tested in Jefferson County, 364 individuals in Mercer County, and 404 individuals in Raleigh County for our drive-through testing. That's a total of 2,388 tests. We're waiting on results from those. The results, of course, will take a couple of days. We did just get information in that we had 63.6% white population, 33.8% Black African American population. This is at Raleigh County, sorry. And we had 2 Native Americans in Raleigh County. We also had in Mercer County 60.1% of individuals who are white, 66 or 36.2% African American, and 1 Hispanic individual. So that testing is moving along quickly. We have testing scheduled for Friday and Saturday of this week, and we will provide more information on that later in the week. Assisted living update. We have 69 of 94 assisted living communities have reported through the web as of 9 a.m. today. 75% of those facilities have started testing. 15 of 17 of those facilities that had not reported starting testing have a scheduled start date on or before Friday. We have 55% of those have reported completed testing, and 16 have received all results. To date, 465 residents and 650 staff have tested negative. 4 assisted living facilities reported cases of COVID-19 in staff, 5 cases, and residents, we had 1 individual. So a total of 2,742 tests have been completed, with 32% of those tests pending for residents and 37% for staff. Child care center testing. We have 38% of the child care centers operating with 587 staff tested. We've had 3 positives, 582 negatives, and 2 pending. Our child care centers are currently operating in 37 counties in the state. And that's all I have right now. Thank you. Sorry for all those numbers.
All right, thank you both. Major General Hoyer from the West Virginia National Guard is also joining us today and is available for questions. Once again, we're holding today's briefing with the media members joining us virtually to practice good social distancing. The first questioner today is Paul Mullen with WCBC.
Good afternoon, and thanks for the time. Good afternoon, panel. Governor, I want to follow up on your comment about someone, a staffer from a nursing home, maybe going to Walmart and then maybe bringing that back to the nursing home. A couple questions there. Number one, what are the protocols? Do we have different protocols for people that work at nursing homes these days, and how they are avoiding doing what you described? And also, is there going to be a second round of testing at nursing homes as we get into this a little bit further? I'm wondering if you tested 3 weeks ago, that test was good that day, but we're 3 weeks down the line and we really don't know what we have out there right now.
Paul, let me start off, and then I'm going to pass to Secretary Crouch and Dr. Slimp. You know, as far as the guidelines and everything, as far as the protocol, you know, of workers that are there, and as they go home, and they're intertwined with their lives that they're living and where they're going and all that kind of stuff. But Paul, I'd like to jump more to your second question. You know, I think that we've all got to know, and let's just go back and think back about the whole deal. First of all, right off the get-go, the very first things that I did was cancel the visitation to the nursing homes, because we knew what we were getting into. We were the first state in the nation to test all the nursing homes. Absolutely, we need to continue that testing scenario, and really, if our medical experts, if we have the testing capabilities, as we're getting more and more and more each and every day, we need to keep going back and going back and going back until we get to the situation to where these people feel very, very, very safe. And the only way we're going to get to that is that drug or the vaccine. And so in the interim, what we need to do is continue to go back and test more and more and more as we go forward all the time. This one test is not going to assure us that everything is going to be safe and all is good from now on. It's just not going to do that. You know, we need to keep going back with Paul, but I'm going to defer now to Dr. Slimp and Secretary Crouch.
I can speak to a couple of those things. The guidelines and protocols are in place in nursing homes. They take this very, very seriously, and all healthcare workers are screened for symptoms, screened for potential exposures when they come to work. check temperatures. They utilize PPE. They take other precautions in the facility to really mitigate any risk of bringing in disease to the community to the facility as much as possible. So they are taking this exceedingly seriously. Similarly, they do have to lead their lives elsewhere. And I think they recognize that and work to prevent any potential exposures or spread to their families or to the community more broadly. We did in our nursing home survey, in our executive order testing, find some new cases of disease, and we found more of those among the employees or the staff than among the residents. So there were only 11 new residents identified with COVID-19, and there were 30 some staff that were identified. So we are seeing a higher incidence among staff when we do these screenings. And I think that actually is helping guide as we work with medical directors and administrators of nursing homes what our ongoing screening should and might be in these facilities. So more to come on those recommendations on screening further.
All right, thank you, Paul. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Thank you all. Dave Mistich, West Virginia Public Broadcasting. I'm seeing a lot about these contact tracing apps. Particularly, I just saw one out of the Carnegie Mellon in Pittsburgh. I believe it's called Novid. A lot of these apps, from what I understand, trace people's movements, try to tell them whether or not they might have kind of come in contact with a person that has COVID-19. I'm curious, Governor, and some of the health officials, are you guys thinking about, asking the state residents to use such technology? Are there any concerns about privacy? I guess, what's your position on trying to use technology to boost our effort with contact tracing with all this?
Well, I think Dr. Marsh is more on top of this than anybody on my staff that I think, and I think Dr. Marsh, and maybe General Hoyer can weigh in, but I know Dr. Marsh can, but anyway, Clay, if you'd take over.
Thank you, Governor. Well, thanks for the question, Dave. Of course, we are looking at all of the types of technologies that might be able to help us and help people feel safe in West Virginia. Certainly, we do also have in preparation those types of technologies. And what we're really trying to do is we're trying to understand best how we can create the usefulness of that technology. In other words, helping define interactions via phones of people who have the app downloaded, as would be true for the Carnegie Mellon app, yet also still protect people's privacy. And so in many of the apps, at least in this country, people tend to be more hesitant to download it. In other countries, like in South Korea and China, those are required. Atul Gawande, a really prolific writer and really smart guy, physician, talks about having to check in the Harvard system and get a QR code to be able to come into the building and go to work correctly. So I think there's many ways to deploy these types of apps. And there's a geofencing capability. So if you do have those apps and people are using it, you could start to give people insight into where other activity might be. But as we are planning for our contact tracing and certainly working to try to both train more people and to really underpin the great work of our county health officers and local health departments, these types of technologies can be useful. But as you rightly point out, there are privacy issues and there are, voluntary uptake issues that can either make them very useful or render them a lot less useful. And the only other thing I would say is that Google does work looking at phone mobility, and those are posted online to look at where people are going. So other people are also working with phones to look at mobility of people related to stay at home and those kind of orders.
Governor, I would just add a couple of things. Early on in this, DHHR Public Health built out a pretty robust epidemiology effort using 7 regions, which the Guard has 44 personnel supporting. that effort. But going forward, I think it's a matter of striking a balance between technology and good old interaction with people and the county health departments and people. And my sense is that having looked at this, West Virginia through the public health initiative with DHHR has done a pretty strong job ahead of the curve working through this. Thank you.
All right, thank you, Dave. Next, we'll go to Kenny Bass with WCHS and WVH.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. I have some questions about the testing which took place over the weekend in the 4 targeted counties. One, how was the response to that? How was the reaction to what went on? When will we be seeing results from those tests? And the next counties have already been named, among them Kanawha and Cabell. When will those counties' testing sites and dates be made public? And because it also targeted the African-American community, I'd like to get a copy of the members of that African-American task force that's been assembled by DHHR and the State Health Department. I'm wondering where I might obtain that information.
Okay, guys, if I can start, I hope Secretary Crouch, maybe you can start with us and everything, but and Dr. Slimp, but I think Kenny's got some good questions and everything. Let's try to answer them.
Sure.
Yes, sir, Governor. As I mentioned, we had about 2,400 people tested over those 2 days in those 4 locations of Berkeley, Jefferson County, Mercer County, and Raleigh County. So we have pushed very hard to increase the number of test sites and the amount of testing we're doing. It's one of the reasons our numbers keep climbing relative to other states. We will have information and we may have locations. I don't have those with me, Kenny, in terms of where the sites are Friday and Saturday, this Friday and Saturday for the other counties, but we have that information. We'll provide that to you tomorrow and to everyone tomorrow. I really didn't hear the rest of your question with regard to the African-American task force. So if you could repeat that.
I'm wondering where I could get information on the members of that task force. That information seems to be difficult to obtain, or else I haven't looked in the right place.
We're happy to provide that information. I had not had that request. It certainly hadn't come to my attention. We're happy to make that public. Yes, sir.
All right, thank you, Kenny. Next, we'll go to Steve Adams with Ogden Newspapers.
Steve Adams here of Ogden Newspapers. Question, I was reading a story this weekend. It was either Wall Street Journal or New York Times, but they were specifically talking about states that are having issues in regards to road maintenance and major road projects, obviously because with a lot less travel over the last 10 weeks or so, you're talking gas tax sales are down, things of that nature. Now, I know our road fund came in above projections. A lot of that was federal money. And I know that we've just put out or about to put out several projects for bid for Roads to Prosperity. But just sort of long-term thinking, are we having any concerns about being able to fund small-scale projects or basically secondary road maintenance into the future due to possible decreases in gas tax sales and whatnot? Thank you.
Okay, Stephen, I think I can answer this and everything, but I can tell you that, and I want Brian Abraham to come up and Brian, you can also answer some of this, but I know this, that as far as the spring work, we had a tremendous amount of rain in April and early May, and but we've gotten our new pavers in. We're doing training on our new pavers right now, and you're going to see an influx of stuff as far as people, fixing potholes and doing work like that. That's going to be going on in a great big way, and it's going to be going on right now. So maybe if we could switch to Brian could have some additional information. Let me stay with me just one second. Let me just tell you this. The one thing that I try to do is, and I'm going to do this no matter what, we're going to be totally transparent all the time. Totally transparent. We want you as viewers to watch every single thing and us to try to show you every single thing that's going on. Now, in that also, we have the media ask questions and everything, and no matter what the question is, I'm not going to dodge the question. And if I'm not happy that our experts have given you an answer that's clear enough, I'm going to intervene as I have in the past and say, that's not good enough. And we've got to get more information for you, and we'll get more information for you. Or maybe I know more information, and I can add that to the conversation. But we don't dodge questions. We're transparent. We take every question, and so I'm just trying to get you more and more information. So, Brian, if you could answer that maybe a little bit more.
Well, the governor got it near perfect on that. We do have the road crews getting ready to start with the yearly patching. We ordered, I believe, in excess of 10 new pavers last year with money we'd gotten from the legislature. In addition to that, there's purchase order contracts that Highways is getting ready to put out for the spring paving season. We did have a very short period of time when the money got a little behind based on the reduction of the fuel taxes, but we got an influx of federal money that allowed the highways to do some shifting around. So Secretary White keeps us up to date on a routine basis, and you're going to see this take off. This has always been the governor's priority since he got here, was our road program, and we're continuing with that.
All right, thank you, Steve. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I wanted to go back to the slide about week 5 and the openings that start Tuesday, May 26th. I know there are some plans to open smaller entertainment venues like museums and visitor centers and zoos, but I wondered about your plan to open entertainment like pools, bowling alleys, and I was also on that slide confused about indoor and outdoor bars at 50% capacity. Is that because of those other DHHR square footage guidelines? So is that an increase in capacity? And when do you plan to look at increasing capacity in general? Thank you.
Okay, Amanda, let me go to the first part and say just this, that we're trying as best we possibly can, again, to not necessarily purposely hold something back, but we're trying to not go all in all at one time. We're trying to go with our medical experts as things like the pools or bowling alleys or whatever like that, where people are maybe closer together and everything. We're trying to just not go all in all at one time. And we're very well aware that our pools and everything are right there, and our bowling alleys and all that kind of stuff. And we're going to announce, dates and guidelines to open them. And hopefully we're not going to push that way back in June. Hopefully that's really going to happen in the next couple of weeks. But again, we just got to continue to watch and monitor these numbers. And as far as the occupancy, I am well aware that, that a restaurant or a bar that's operating on 50% capacity may have a whole lot more trouble in the economics and making that come out and everything. But I'm also well aware that the closer we get, the more and more potential problems we got, and we just got to be able to work through it. That's all there is to it. It's just as simple as that. So maybe if Secretary Crouch or somebody could weigh in on the guidelines of the 50% occupancy and everything, please do so.
Yes, Kathy will speak to that.
Be happy to, sir. The rules that relate to square foot occupancy have actually just been filed for public comment, and they were modified to be very clear that they apply to retail establishments, so they would not be applicable to restaurants. Those really are those guidelines. That 50% occupancy is based on trying to maintain that social distancing in the restaurant setting and be practical there. So those are out for public comment. Again, they have the same limits at present. But they are clarified that they apply to retail establishments, and also had some clarity around issues of polling places.
All right, thank you, Amanda. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, all. This is Taylor with the Herald-Dispatch. About the testing in the vulnerable communities, African American communities. Just wondering if you could talk about the outreach that you're doing to let these communities know that the testing is available to them. How are you getting that information to them?
Secretary Crouch can answer it, you know, and everything, but Taylor, it is Taylor, is that correct, Jordan? Okay, but Taylor.
Yes, sir.
Taylor, if I could just say, you know, we need badly to push the outreach as much as we possibly can to especially these communities, our minority communities, the African American community, and the reason for that is just as simple as one thing. From the standpoint of statistically, and we watched it in New York more than anywhere. In New York, we watched thousands die. And the percentage of African Americans was greater, significantly greater than it should have been. So we need to constantly work on that outreach. We've tried, and I think Secretary Crouch can offer up some more detail.
Yes, sir, Governor. Thank you. We've had 2 meetings of the African American and Minorities Task Force. We're really looking for their assistance, and they've provided a great deal already with regard to how to get the messaging out in terms of testing. As I mentioned earlier, we had 33, almost 34% African American population in Raleigh and 36% in Mercer counties. We'd like to have more response for testing overall in Mercer and Raleigh, but we're getting a good turnout from the African American population. We want to do more with regard to that population, and this testing that we're doing actually started as testing for the African American and minorities population. The task force was created after we already were in the process of developing these testing sites. So they came in a little late from the standpoint of providing us that guidance. We're looking forward in the future to really getting more information. But I have to say that they've been very beneficial already in terms of how we approach these communities, where in the communities we should set up the testing, where we should put notices out to increase testing. And again, we were about 3.4% of the population is African American. So our turnout, we think, was very good, but we're going to try to do better with that. And we're going to use the task force to help us get that, to get those numbers higher.
All right, thank you.
Let me add one other thing, Taylor. You know, if you just look at what, you know, Secretary Crouch just said right there, you know, 3.4% of our population are African Americans in the state of West Virginia. And in those, I think in those numbers that he was saying, you know, we had like a 36% turnout, you know, of African Americans on the number of tests that we did and everything. And that in itself says, well, gosh, that looks really great and everything. But the sheer numbers are nowhere close to where the numbers need to be. You know, and what I'm saying about that is if you look at 3.4% of the whole population and 36% of those tested were African Americans, great, it's great. But we just need the numbers to be up. And so to get the numbers up, we need the outreach to be better and better and better, and we're working on it.
All right, thanks, Taylor. We have time for one more. We'll go to Brad McElhenney with West Virginia Metro News.
Hey, Governor. You might need to get out your whiteboard for my question because I'm trying to figure out a gap on something in my information. My understanding is West Virginia's testing strategy right now is people with symptoms, people who are exhibiting the symptoms of coronavirus, and vulnerable populations like people at nursing homes, people at senior living centers, the African American communities. But there is also a new rapid response system where it is triggered by 7 days of increased positive results. What I'm missing is the gap. Where do we get the information for the rolling 7 days of results? Is that generalized testing, or is it coming from those testing priorities that I described earlier in my question? Thank you, and sorry.
Okay, Brad, I tell you, on the testing, you know, I'm going to pass that to Dr. Slint, but I'm going to do my whiteboard here, okay? And here's the whiteboard. We're testing people, and I'm going to go slow, people that are people with, I'm going to say, with with problems. Okay? All right, that's who we're testing. People that are the most vulnerable, the nursing homes, the elderly. We're testing people. We're testing lots and lots and lots of people, but we're testing people that are feeling bad or have issues or whatever. Now, the people with problems thus far on the number of positives, versus the number of tests taken are that. 1.96% today. The number of positives by the number of tests taken, we're at 1.96%. Now, what would happen if we tested people with no problem? If we tested people with no problems, really and truly, the likelihood of that number would probably be a number like 0.5%. Now, we've tested 76,000 people that were this over here. 76,000 were people that, just like you said, are the most vulnerable or the sick or whomever it may be. 76,000 were tested with a problem. And they test now at a percentage basis of 1.96%. I'm only guessing. But if we tested everybody, people with no problem, our numbers would be so minuscule, it would be off the chart. And so now, as far as how the testing is done on the new methodology and everything, if Dr. Slimp will end up with that, that'll be good. But I enjoyed my whiteboard, Brad, and I'm glad I got to use it. I haven't been able to use it in a long time.
Governor, thank you. You are right on target with that explanation of thinking about strategies of testing. The goals really are twofold with testing, and we really are looking at what's this longer term testing strategy that we want to be doing. The goals are first to identify individuals with disease so that we can rapidly link them into case investigation and contact tracing and the supports they need to isolate or self-quarantine if they are contacts. So that is where we're speaking about things like really looking for anyone with symptoms that may potentially have COVID-19, that kind of diagnostic testing. We are also looking among populations that have higher risk of having disease so that we can, again, even though we're doing more broad testing, even looking for asymptomatic cases. So that's goal number one. Is to find and identify those cases so we can really respond. Goal number two is to further understand the prevalence of disease in our populations and the occurrence of that disease. And so some of that community-based testing gets at that more. So I'd say there are 4 buckets that we are thinking about with, and some of them we have actively got underway, others we're evolving. So there is the bucket of those with symptoms, the diagnostic testing that the governor mentioned, where we will probably have much of our highest incidents occurring. We've got the vulnerable populations that we've been testing systematically and those who work with them. And then we've also got testing on the community-based level in terms of just what we began last week in terms of some of our high-density population individuals and African-American population, minority populations. And then the fourth area, which we also do, but we are looking at how to expand that further, is testing among our contacts and contact tracing work. Currently, we certainly monitor each of those individuals for occurrence of symptoms, and as soon as they develop symptoms, we test immediately. And they were exploring, is there a broader way to do some testing there to identify potentially some of those cases even earlier? So those are the buckets that we're looking at with that and planning that strategy moving forward. And I think we've been doing a lot of this preliminary work to really understand what's happening in communities, and that can guide that surveillance work to follow.
All right, thanks, Brad. Governor, I'll turn it back to you.
Okay, everyone, thank you for being with us today, and please remember the 5 that we lost. it's a terrible loss, and they're great West Virginians, and please recognize their contribution that they've made. It's unbelievable, and that we just our prayers, our thoughts, our love, and everything is absolutely with them. I would tell you again, West Virginia, be cautious. You know, Texas started opening back up, and they opened back up probably more aggressively than what we're doing, but they jumped back at it and everything, and before you know it, it jumped back at them. And they have had, you know, watch the news, watch the numbers and everything. They've got some issues going on, and they've got to address it. I would just tell you, just please be very cautious in what you do. Let's absolutely crawl before we run. I want to take time to do one thing, and that is salute all those that are out there on the front lines that have been there. Please just take time, if you can, to show your appreciation and love to everybody, from the county health officials to first responders. I know I'm going to forget somebody here. Please forgive me. But the healthcare workers, I mean, for crying out loud, you know, these people have been unbelievable. You know, our fire and police departments and National Guard, and on and on and on. And just please forgive me if I forgot somebody, and it's easy to do. And so as I leave you and everything, I just thought, our emergency services people and our emergency managers and everything, you're right in there with all these people, and thanks from the bottom of all of our hearts. We love you, and we really appreciate you and recognize all the risk and everything you've endured with yourselves and your families. And so please just take time to be appreciative to those, and keep them in your thoughts and prayers as well. And the last thing I'd tell you, West Virginia, wear mask. Wear your mask when you go out and everything. Please try to do so. And just be safe and be careful and take care of the elderly, and we'll be okay. Thank you so much.